Hello, and I'm Dr. Corey King from AskDrKing.com. I specialize in working with patients who are struggling with chronic health conditions, especially autoimmune conditions. Recently, I had a thyroid patient ask me, Dr. King, what are some of the triggers that's driving my condition to become worse? This patient's doctor just wasn't quite helping her out the way that she thought that he should be. So today we're going to talk about 5 triggers that I find drive not only thyroid conditions, but a majority of chronic health conditions that are out there. The first trigger is going to be infections. Infections can come in the form of bacterial, viral, parasitic, or fungal infections. Infections can get in there and they can inhabit the small intestine, large intestine, the colon. You can get fungi into the lungs. You can get infections in the stomach like H. pylori. So whether it's a bacterial infection, a parasitic infection, it could be viral like Epstein-Barr virus, or a fungal infection like mold, for example. Those infections need to be not only tested for, but if they're there, they're going to have to be eradicated. The second trigger is a bad functioning gut lining. And what I mean by that specifically, it's called leaky gut syndrome. And this is what I grew up with. I grew up with leaky gut syndrome. So imagine your intestinal tract having all these big holes within all the intestinal cells, and now these cells that are nicely packed together, they start to develop these holes in them, or the cells themselves, if this was a cell, the cell itself can be bad, so that way things pass right through it. Leaky gut syndrome, what it does is it's going to cause foods, undigested foods, medications, all to pass that gut barrier and get into the bloodstream and create inflammation. Inflammation for a chronic health patient is crucial to get under control. If the body's inflamed, you're going to have pain, you're going to be exhausted, you're going to have brain fog as well. Inflammation just destroys tissue in the body. The third trigger that I find in all of our chronic patients, especially our thyroid patients, is liver dysfunction. The liver plays an extremely important role in thyroid hormone conversion. It's responsible for 60% of your hormones to get where they need to go. That's 60% in just one organ. So if that liver is not working optimally, yes, a thyroid patient is not going to be getting their hormones into their cells properly. A thyroid patient, or any patient for that matter, can have their male hormones or their female hormones skewed because of this, because the liver plays an extremely important role in your hormones. Not only that, but your liver is your big filter. So all throughout life, it's helping to filter all this inflammation. Everything that comes into your body as far as toxins and medications and things like alcohol get filtered through the liver. So how many times have you cleansed your liver? And a lot of patients, when I ask them that question, it's big goose egg. So think of your liver like your lint filter in your dryer. And if you do not clean off the lint, you know that your dryer is not going to work optimally. The fourth trigger is blood sugar. And what I mean by blood sugar is not the fact that we're talking about eating a bunch of sugar, which you shouldn't be doing anyways. But what I'm discussing is keeping your blood sugar at an even keel throughout the day. We don't want to see big spikes in blood sugar like this. So if blood sugar is spiking, then that is a big problem. If the blood sugar is crashing, that is another big problem, because then cortisol gets released. And cortisol's job is to raise your glucose levels, but it does it at the expense of creating inflammation. So we want to make sure that blood sugar is being stabilized throughout the day. And then the fifth trigger is going to be food sensitivities or allergies. And we're seeing more and more of this. I personally think it's due to the quality of our foods and also our body's ability to break the foods down. But if you have any food sensitivities for example, dairy, you know you can't have dairy, but you go and you cheat on dairy, your health condition is never going to get better. You're just going to create inflammation within the gastrointestinal tract, and that's where 80% of your immune system is located. So if you're struggling with a chronic health condition, look at those 5 triggers. So we talked about infections, we talked about gut health, we discussed liver health along with stabilizing blood sugar, and staying away from those food sensitivities that you know create inflammation within your body. So to learn more, you can visit our website, AskDrKing.com. You can take a look at our Facebook page, Ask Dr. King, which we share a ton of recipes and ideas on there, or you can watch our YouTube channel, Ask Dr. King. Until next time, have a great day.